So I only went for an MRI to make sure everything was fine. But when I saw the images, I saw lymph nodes the size of a fist from my groin up to my neck. And of course, as a doctor, I immediately knew this was serious.
Given everything you've learned today over the course of the last 9 years, and you had to give a clinician one piece of advice on how they might interact with a cancer patient, what would you tell them? Hi, everyone. I'm Samira, the host of the podcast, The Patient from Hell. I have a very cool guest with us today. I have Dr. Achim with us today, he'll tell you more about himself, but I believe he is calling us from not the US.
You're right. I'm living in the southern part of Germany, near Stuttgart.
That's amazing. Dr. Achim, maybe you can just tell us a little bit about you before we hop in. I have a series of questions, of course, but maybe you can tell us the multiple hats you have worn in.
Yeah, I think this might be the reason that, and thanks for having me here, that I reached out to you initially. Because, it's not just one perspective I have as a cancer survivor, but also the second one, I'm a physician. So I treated cancer for quite some time on a conventional medical basis. And also by now, I'm also a 2-time family member of a cancer patient. So at least these 3 perspectives are united in me, and also the 2 times of making this experience as a loved one differ greatly. So everything I went through is for the better and makes a difference. I see the reason behind it.
Maybe we can start with you as a clinician. Can you tell us, so you're in Germany, can you tell us why you became a clinician treating oncology, and what happened during the course of your experience that when you became a patient started to shift?
Well, that would be a long story, Well, I always had this deep feeling of that it is just a great thing to help other people. And I, after school, I did 1.5 years in rescue medicine as a paramedic. And this was my entry point. So helping people in this tremendous need when nobody else is there. And this gave me such a strong feeling of a strong reason to be here, a reason for this life. And I thought, okay, I need to study medicine. And that's how I got into this segment. I worked in internal medicine, in intensive care, radiology, but then realized I just can't stick to this for my whole working life. We did about 90% of CT imaging. CT scans were for cancer patients, for measuring tumor counting, to be honest, staging, diagnostics. I was 30 back then, and I never could leave what I saw during the day in the locker room. I always took it back with me home. Patients getting younger and younger, 15-year-old patients, and I won't see you again in 4 weeks. I know that this would not end well. So I thought there must be other ways to support patients, and that's why I joined the pharmaceutical industry. I worked a lot in oncology, development of new oncology drugs, worked a lot also in rare diseases, because this is also a segment where help and hope are desperately needed. And this is the business part, at least until 2017, when I got my diagnosis.
What did you get diagnosed with?
So it was a relatively far progressed lymphoma.
And how did you find out?
Well, in 2017, my life in a way finally came together. But internally, I'd been struggling for years. So there's a lot of things that happened. So I had grown up with beliefs that I wasn't enough the way I was, and that I had constantly adapt and to function in order to be loved. It shaped so many decisions in my life. I stayed in a 10-year relationship that wasn't really my life. And this is not meant as a blame, but because I didn't know how to choose differently back then. And at work, I had a lot of struggle. I carried patients and colleagues emotionally. In 2017, I met the love of my life. I left this former relationship, and for the first time as an adult, I thought now is my turn to take care of myself, really take care. And the irony was that I actually felt physically well. So I only went for an MRI to make sure everything was fine. But when I saw the images, I saw lymph nodes the size of a fist from my groin up to my neck. And of course, as a doctor, I immediately knew this was serious.
What made you go for an MRI?
I had some swollen lymph nodes for years on my neck, but I was never important enough for myself to really take care of this. I needed to take care first of my relationship, of my company, of my family, and so on and so on. And, back in my head, something probably just hoped, well, maybe it's just something normal, benign. It will be okay. And I wanted this proof, this stamp on the inside, Achim, you are as fine as you are on the outside. Turned out differently.
So you see the images. You're a doctor, so you figure out fairly quickly this is serious. What do you do next?
I drove back home. I sat in the dark, and I did what probably many patients are doing. I went to Google. Now it would be, of course, artificial intelligence, but back then it was Dr. Google. Of course, I really didn't need it because I knew the diagnosis, differential diagnosis, prognosis, 5-year survival rates. I knew all this. And this is one situation where knowing more really didn't help. It made it worse because I didn't just search. I understood what I meant, and I found proof for my worst case scenarios that I already had made up in my mind, of course. And I did book already for my worst case scenario. At that time, there was this strange irony. I had just found the love of my life, and now might have to leave again. So this first days were just chaos. No structure, no clarity, just fear, anger, emptiness, loss of ground. I assume like with anyone else who is in the situation.
I have 2 questions for you. What was the worst case scenario?
I won't be able to see my children grow up. I won't be there for them as a father.
But I definitely appreciate that, but you also understand the overall survival. So just out of curiosity, when you were looking, what was the overall survival for you?
1 to 2 years.
So here you are, you found love of your life. You've understood that it's 1 to 2 years. You haven't really met an oncologist yet, but you have worked in oncology, therefore you know already. But you're still Googling it. What's making you Google it?
I know it's silly. I tell everybody, don't do it. But I'm sure almost everybody is doing it anyway. So I'm just as smart as the next guy. As far as I can see it, also from people that I support, and let's just term this group as we just look for any kind of hope, no matter where it might come from, and clarity and structure, something that you can hold on to when you feel that everything that you relied on and held onto in the past is just gone away within a second. Of course, intellectually, it's stupid to go there. Everything you read there, in my impression, is something that proves your worst case scenario. Most people that are going through this in a good way and are grateful, and there is a level of God's grace that you cannot ask for. You don't know if you get it or not. But the people that are going through this world very rarely inform others about it. They just go on with some kind of life, a former life or something new. I hope something new. But you read about all the bad things, poor outcomes, poor study results. Yeah, looking in. Of course, I did a lot of research instantly in PubMed and got other publications. And you know where I looked at all the survival curves. It was obviously, and it was very clear that I would not be there after 5 years.
Here you are.
Yeah.
So in some ways, I mean, I'm a scientist myself, and for what it's worth, do not think it's silly to Google things, because I think you said it really well. I think in a moment where your life has basically been pulled out of you, you're looking for anything. You're seeking hope, you're seeking clarity, you're seeking certainty. And the only real consistent source is Google. Right now, so for what it's worth, I don't think it's silly. I have yet to meet a patient who has not done it. At this point, I've met thousands and thousands of patients across the country, across the world, actually. So I've met thousands of patients. I've never met someone who hasn't done it, regardless of age, regardless of demographic, regardless of outcomes, regardless of how good or bad the prognosis is. Like, I think it's one of those universal traits, because the reality is the cancer diagnosis is such a surreal diagnosis that I don't see an expectation for someone not to do it. Anyway, this is not about me. But here you are, 5 years later. Many, many years. Actually, what is it? Almost 9 years later?
Yeah. By now.
How are you here?
Not by staying with what I believed back then. I was trained as a physician. I believed certain things, and I learned very quickly that I was wrong in many things that I believed in. I thought I understood what it means to receive a diagnosis like this. But there is such a fundamental difference between understanding something intellectually and actually living inside that experience. Of course, as a physician, I could empathize, but I didn't know what it feels like when everything suddenly loses meaning and nothing gives you orientation anymore. Anything that had any value yesterday doesn't have any value today. Most things. I didn't know what it feels like, even simple things like the continuous nausea of the treatment, the exhaustion, the depression during chemotherapy, when they are becoming so overwhelming. And this is to a degree you cannot imagine beforehand. And I believe, at least for me, I can say I couldn't imagine before I was in the situation. And one of the biggest misconceptions I had was believing that knowledge would help me feel more in control. Because the opposite was true. More information did not create any safety. It created fear, because I fully understood what the possibilities meant. And I believe that no one teaches you how to process that, neither in medical school nor in clinical training. This whole process taught me a lot of things that medical school never was able to.
I have so many questions here. Do you think medical schools should be teaching people about this?
I'm not sure to which extent this can be trained, but for sure, at least in Germany, I can say that empathy is not a topic in medical school. And of course, in our system, basically, we have no time for empathy. Yeah, not only for me, but fair enough, I only talk about me. Conventional medicine was just my world, and everything outside of it.
Yeah.
I used to look at with a certain and a strong level of arrogance, to be very honest, simply because it wasn't part of what I had learned. You are taught facts, diagnostics, treatment pathways, but no one really teaches you what actually happens inside a person when their world collapses. What I had to learn in my whole journey was, hey, we are not just the body, we are body, mind, and soul. But in conventional medicine, typically, most of it, in oncology, in surgery, and so many other things, we are focusing on the body alone. But we are so much more. I believe this is something that you could be educated to a higher level in med school, even if it's all 99% around conventional medicine. But to educate you, to bring you to a certain level of openness, that there are other things out there that are equal, that conventional medicine is one piece of the puzzle for an individual treatment path. And I believe every single treatment path is individual. We are not cars. And conventional medicine can be a part of it if the patient has beliefs in this. But there are other things out there, so many things that can be equally relevant for this specific patient as they were for me.
Dr. Achim, so this is 2017, your world kind of shatters. You're in this dark room, you Google it, you start to begin to realize that information isn't actually helping you. It's basically confirming the worst case scenario. But you went into treatment. You undergo effectively conventional medicine. You begin to realize that there are significant drawbacks to the way conventional medicine is set up, as well as the way clinicians are trained. What happens next?
For me, I just redefined the role of conventional medicine. I just accepted that it's an important part for me, but it is in no way the whole answer. And I remember I intensively remember this moment when I stood in front of the mirror and made this decision that changed everything. That I said, I'm willing to question everything that I thought I knew. And the key question I asked myself was very simple. What do I have to lose? Because the honest answer was nothing. Because in that moment, it felt like I had already lost everything. And this was also the moment, and that's why I mentioned some private things at the beginning too, that I started fighting for myself for the first time. Not for others, not for my family, not for expectations, but just for myself. And even that felt really awkward at the beginning. It felt like, I was in shame that I allowed myself to focus just on me and not on all others. So I began very softly, very cautiously to explore other approaches, not blindly, not irrationally. I'm a scientist anyway, but with a very clear filter. Something has no meaningful downside, but a very small potential upside at least. Why would I not use it? Why not trying it? Again, what do I have to lose? And at the same time, conventional medicine played an important role for me because I feel it just bought me time to stabilize, to regain some trust in myself, in my body, to regain energy, and just open up this time window to find my own way. And out of all of these experiences came this idea of an integrative pathway, not as an alternative, but as a structured way that actually helps.
You and I think of the world actually in eerily similar ways. I've had a lot of guests on this podcast, and I have met a lot of people in the space.
Mm-hmm.
But there were like two things you just said right now that like really, really struck me. The first was looking at yourself in the mirror and making that promise to yourself of effectively reevaluating how you see the world. I would love for you to talk a little bit more about that, because I know that a lot of patients, myself included, looking at yourself in the mirror when you're going through cancer treatment is one of the most surreal experiences that people go through, myself included. I remember being like, who is this person? I just don't recognize the person.
Mm.
There's this moment of like, I don't feel like me. I don't look like me. The notion of me is gone. There's something that does happen in that moment where it gives you almost a blank slate. There is a moment of like, wait a minute, if this person's not me, who am I? And I think the next question becomes, who do I want to be?
Mm-hmm.
And I would love for you to talk a little bit more about that, because I don't think we do justice to that moment.
Well, it might be important to mention that this moment, this look in the mirror, this didn't happen 2 days after the diagnosis. It took me months, and it's good that way. It wouldn't be helpful at the beginning, but I say this just that everyone that hears this doesn't put themselves under some kind of pressure. I think it's important to allow yourself that you will never be the same person again as you were in the past. And I've never talked to anyone who said, well, and this is a disadvantage. It always was for the better. It feels strange at the beginning. Nobody asked to start this new chapter of their lives, but it happened. Yeah, I believe it's so important to find out more closely on who you really are, what you really want to do with your life, what the values are in your life. And these are so essential. I learned so much about myself. I learned I did this deep work during chemotherapy, not knowing how long I will be here, but realized at the same time, wait a minute, all the values I was looking at, these aren't no values at all that I want to be remembered for. You know, everything was like there was another Achim, an ideal one probably for some partner, for somebody in the family, I don't know, for some friends. Friends is also a specific topic we need to mention.
Yeah.
But overall, the more you learn about yourself, and again, there are so many aha moments with anybody I support, the better you can follow up, the stronger you feel by taking any decision, because you can always start before taking the decision to reflect on your values, to reflect on your goals. No matter if you say, well, I assume I will only have months, I assume I will only have 5 years. You never know. We never know.
Yeah.
So just stick with it, allow yourself this reflection, and you will feel more grounded day by day. And this all starts with an honest look in the mirror, and just allow yourself that you won't feel good, that it will feel strange, that you will feel lost. But remember, you are standing on solid ground in this moment, and you can start from scratch, and you can start with a clean slate. You can take new decisions, healthier decisions that are in favor of you. And we are going in so many other topics, but I hope anyway that I was able to answer your question.
You definitely were. And I think it's, I know we're going down different tangents, but I think it's one of these moments that is so common, but I don't think we talk about it. I do not think we give it, honestly, due credit. Because I like you, I have not met a patient who has said my life is worse post-diagnosis, which is really like such an irony. It's such an irony.
Yeah.
But I just haven't met them. And life is much harder. It feels much harder. It can be devastatingly difficult. And yet, especially those who are dealing with metastatic disease is something I have seen. They just, in a weird way, have a better emotional life. And I don't think we talk about it. And I don't think traditional therapy talks about it. So, okay, so you're going through this many months later. You're looking at yourself in the mirror. You make this decision to start from scratch and to kind of question the world that you live in. You start exploring integrative medicine, but you're bringing to it a scientific mind. What's an example of something that you start exploring early and you start trying?
This relates to a question that I ask myself, and I guess probably everyone asks themselves this question: why me? Why the hell just me? Why did I get this? And after some time, I got an answer from somewhere, from the universe, so that you can be a shortcut for others. And that was the moment when I thought, well, probably I'm writing a book about this. Not about praising myself, but giving some inspiration and some ideas on all the things that are out there that could be helpful. There's no guarantee, but just to raise this awareness, you are not stuck in this being a passenger on your own journey. In this, you can take back the responsibility for your life, and you can support yourself in so many ways. And I of course I did a lot of research before I decided to do something next to conventional medicine. And the more I looked into this, I realized how much proof there is already. Because in med school, I always learned, well, there is no proof for anything apart from conventional medicine. And then I researched it, and so there's already proof out there. Clinical trials testing Group A, just conventional medicine. Group B, conventional medicine plus, for example, 2 meditations per week. Statistically significant, less time in hospital, less side effects, longer remission times. And I found so much proof. Of course, you can always find a study that says differently, but this is the same for pharmaceutical products. And I thought, well, why didn't I ever hear about it? Why didn't I recommend this to anybody? Just to give it a try. Again, come on, a 2-minute meditation per week or even a day. It won't hurt. Just allow yourself to be important enough to stay 2 minutes with yourself. It's so easy. The more I learned about these things, the more I came to myself. And this was a long way, because as mentioned, in my arrogant approach, and this was also just fear of the unknown and the skepticism, that I really needed some time to open up. It was such a generous experience. I'm so grateful for the therapists that I met. So many good people out there.
I am struck by the use of the word generous. What do you
Why?
mean by it was a generous experience?
Yeah, some things like being grateful. Gratefulness is something that I couldn't even use it before my diagnosis. Awareness, what's this, and other terms in this direction. But there are so many things out there that you can be grateful for every single day. It just means where you place your focus on. And many times, I think it often just starts, for example, with a conscious breath, and one thing leads to the other. And I also thought, well, meditation will never be for me. My problem is out there. What use can it be when I sit there and do nothing? I need to do something. And I learned that rather the opposite is true. And it really took me some time to come to myself.
Dr. Achim, if you're up for it, I think we should do part 2, because I don't even think we touched your role as a care partner at all. And I'm watching the clock, and I think we're about to be done. But I if you're open to it, I think your story, your perspectives are so compelling. And very selfishly, I very much resonate with a lot of it. So if you're open to doing part 2, maybe we schedule part 2 and continue.
Yeah.
Okay, so maybe just to wrap up part 1, given everything you've learned today, not today, I mean, over the course of the last 9 years, and you had to give a clinician one piece of advice on how they might interact with a cancer patient, what would you tell them?
I think one thing is listen more, talk less, accept the silence, accept that you won't have all the answers. I think one of the biggest gaps is that we focus heavily on explaining what we are going to do medically, but we rarely address what is happening inside the person. And I often had the impression that we are not even afraid of it. We don't feel well about this area and try to avoid it. Then see a psycho-oncologist and now have a good day. And this is also because I believe we assume that more information creates clarity for the patient. But very often it creates the opposite, because the person has no framework to process it, to process all the information. Anything outside conventional approaches is still often dismissed too quickly. So a certain level of openness would be really helpful. And it's not about believing in everything out there, but if you feel that the patient hopefully is hopeful and believes in something, and you know for sure that this will not harm the patient, why not just say, well, okay, if you believe in it, just try it. I have no experience in it. It's okay not to know everything. I have no experience in it. Just try it. And please tell me how it was for you. I want to learn. More openness, more humility, and the understanding that we are treating human beings, not a simple lab biological system. This is what I would be grateful for in my colleagues.
I suspect that will resonate with a lot of clinicians. I suspect clinicians know. And I suspect that clinicians are also really burnt out.
Yes.
Sometimes they don't have the space. It's almost impossible for them to do it because they don't have the reserves themselves. And all this to say that I think clinicians would actually really resonate with what you just said.
Yes, no, it's definitely not meant as an offense. It's in a system where there's just no place for the human being anymore.
So, super true. Okay, on that note, we're going to take a pause and then we're going to come back for round 2 of this. This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own, and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Mantacares Inc. or Mantacares' sponsors.